ఈ యొక్క ఇంజెక్షన్స్ తీసుకునేటప్పుడు జిమ్లో కానీ స్పోర్ట్స్మెన్లో ఇన్ఫెక్షన్స్ పెరిగే ఆస్కారం ఉంటుంది. ఎందుకంటే సేమ్ నీడిల్స్ వాడటం వల్ల ఈ ప్రొడక్ట్స్ కొంత మేరకు అక్యూట్ పాయిజనింగ్ కూడా వచ్చే ఆస్కారం ఉంటుంది. అంతేకాకుండా సైకాట్రిక్గా వీళ్ళకు మూడ్ స్వింగ్స్ వస్తుంటాయి, పారానియా వస్తుంది, డిల్యూజన్స్ వస్తాయి, ఇంపేర్డ్ అంటే ఏదన్నా ఆలోచన శక్తి కూడా తగ్గే ఆస్కారం ఉంటుంది, జడ్జిమెంట్ కూడా తగ్గే ఆస్కారం ఉంటుంది, ఫీలింగ్స్ ఆఫ్ ఏదో ఒక రకమైన ఇన్విన్సిబిలిటీగా ఉంటుంది, మానియా అండ్ యాంగర్ కోపర్ కానీ యాంగర్ ఒక టైప్ ఆఫ్ మానియాక్ చేంజెస్ కూడా వచ్చే ఆస్కారం సైకలాజికల్గా. అలాగే ఇది ఎక్కువగా ఆడవాళ్ళల్లో మెన్స్ట్రువల్ సైకిల్ డిస్టర్బ్ అయ్యే చేంజెస్ ఉంటాయి, వాయిస్లో మార్పు వస్తుంది, క్లైటోరిస్ కూడా లెంథనింగ్ అయ్యే ఆస్కారం ఉంటుంది. అంతేకాకుండా ఫేషియల్ బాడీ ఎయిర్ చేంజెస్ వచ్చే ఆస్కారం ఉంటుంది. ఆడవాళ్ళల్లో ష్రింకింగ్ ఆఫ్ బ్రెస్ట్ అయ్యే ఛాన్స్ ఉంటుంది. అంతేకాకుండా ఇంక్రీజ్డ్ సెక్స్ డ్రైవ్ కూడా ఆడవాళ్ళలో పెరిగే ఆస్కారం. స్పోర్ట్స్ మెన్లో అలాగే జిమ్ ట్రైనర్స్ ఎవరైతే జిమ్ పర్సన్స్ ఉంటారో వాళ్ళు ఈ యొక్క మిస్యూజ్ ఆఫ్ మనం స్టెరాయిడ్స్, అనబాలిక్ స్టెరాయిడ్స్ వాడటం వలన కార్డియోవాస్కులర్ ప్రాబ్లమ్స్ అంటే గుండె యొక్క సమస్యలు రావచ్చు, సడన్ మయోకార్డియల్ ఇన్ఫాక్షన్ రావచ్చు, సడన్ కార్డియాక్ డెత్ కూడా కావచ్చు. అంతేకాకుండా లివర్ ప్రాబ్లమ్స్, ట్యూమర్స్, అలాగే సెల్ డ్యామేజెస్ కూడా ఎక్కువగా ఆస్కారం ఉంటుంది. మన బాడీలో ఉంటే కండరాలకు సంబంధించిన టెండన్స్ ఏవైతే ఉంటాయో అవి బోన్స్కి అటాచ్ ఉంటాయో అవి డీజనరేటివ్ డ్యామేజ్ రప్చర్ అయ్యే ప్రమాదం ఉంటుంది. అలాగే బాడీలో ఆస్టోపోరోసిస్ అనే బోన్ లాస్లో ఉంటుంది. దానిలో మెటబాలిజం ఆఫ్ కాల్షియం ఉన్న విటమిన్ డి ఈ స్టెరాయిడ్స్ వలన ఎఫెక్ట్ అవటం వల్ల ఆస్టోపోరోసిస్ అనే డిజీజ్ ఏర్పడి బోన్స్ హెల్త్ ఫ్రాక్చర్స్ అయ్యే ప్రమాదం కూడా ఉంటుంది. ఎనబాలిక్ స్టెరాయిడ్స్ వాడటం వలన కొన్ని కాంప్లికేషన్స్, సైడ్ ఎఫెక్ట్స్ ఉంటాయి. అందులో యాక్నే అంటే ఒకలాంటి దురదతో కూడిన దద్దులు స్కిన్ పైన కానీ వస్తాయి. అంతే కాకుండా బాడీలో ఫ్లూయిడ్ రిటెన్షన్ ఎక్కువ అవుతుంది, అంటే ఎడిమా అంటే వాపు రావడం ఉంటుంది. యూరిన్ చేసేటప్పుడు కొంచెం డిఫికల్టీ రావడం, పెయిన్ రావడం అనే సమస్యలు ఉంటాయి. అంతేకాకుండా మేల్ బ్రెస్ట్ ఎన్లార్జ్మెంట్ అంటే గైనకోమాస్టియా అంటాము. అలా కాకుండా రెడ్ సెల్ కౌంట్ కూడా పెరిగే ఆస్కారం ఉంటుంది. అండ్ దెన్ దెర్ ఈజ్ ఎస్డిఎల్ లెవెల్స్ ఏవైతే ఉంటాయో అవి లోవర్ అయ్యే ఆస్కారం ఉంటుంది, ఎల్డిఎల్ లెవెల్స్ పెరిగే ఆస్కారం ఎక్కువగా ఉంటుంది, హెయిర్ గ్రోత్ అయ్యే ఆస్కారం ఉంటుంది, హెయిర్ లాస్ అయ్యే ఆస్కారం కూడా ఉంటుంది. అలాగే లో స్పర్మ్ కౌంట్ అండ్ ఇన్ఫర్టిలిటీ ఎక్కువగా మనము ఈ యొక్క స్పోర్ట్స్ మెన్ కానీ లేకపోతే జిమ్ పర్సన్స్లో మనం చూస్తూ ఉంటాం. అలాగే చేంజెస్ ఇన్ లిబిడో, దెర్ ఇస్ అ పాసిబిలిటీ ఆఫ్ ఇన్ఫర్టిలిటీ కూడా ఎక్కువగా ఉంటుంది. డిజైనర్ స్టెరాయిడ్స్ ఏవైతే ఉన్నాయో ఇవి కామన్గా వాడుతూ ఉంటారు యూజువల్గా అథ్లెట్స్. యూజువల్గా ఇది డోపింగ్ టెస్ట్ చేయటం వల్ల అంటే బిఫోర్ ఎనీ స్పోర్ట్స్ యాక్టివిటీ డోపింగ్ టెస్ట్ చేయటం వల్ల ఇవి మనకు బయటపడుతుంటాయి. తద్వారా వాళ్ళు అథ్లెట్స్ దానికి ఇన్క్వాలిఫై అయ్యి వాళ్ళని స్పోర్ట్స్లో అన్క్వాలిఫై చేసి పంపించే ఆస్కారం. ఇది స్పోర్ట్స్ కానీ జిమ్ ట్రైనర్స్ కానీ జిమ్ చేసే వాళ్ళలో ఎక్కువగా మిస్యూజ్ అవుతూ ఉంటుంది. ఇది కామన్గా అడ్వైజబుల్ కాదు, ఇది ఇల్లీగల్గా వీళ్ళు వాడుతూ ఉంటారు. మజిల్ స్ట్రెంగ్త్ గురించిను ఎక్కువ శాతం స్టామినాతో పనిచేయడానికి, అంతేకాకుండా ఫ్యాట్ కరగదీయడానికి ఈ జిమ్ ట్రైనర్స్ జిమ్లో అలాగే జిమ్లో చేసే వ్యక్తులు ఎక్కువగా వాడుకునే ఆస్కారం. ఇంజెక్టబుల్లో తీసుకునే స్టెరాయిడ్స్ అయితే ఎక్కువ ప్రమోబొలాన్ అండ్ డ్యూరోబోలిన్, టెస్టోస్టెరాన్ డెపో టెస్ట్, అలాగే యాంటీ ఎస్ట్రాల్ అండ్ టెస్టోస్టెరాన్ ప్రొప్రియోనేట్ అండ్ దెన్ ట్రెబనలాన్ అసిటేట్. మౌత్ ద్వారా తీసుకునే ఫ్లోక్సోమెజెస్ట్రాన్ అని ఉంటుంది, మెజెస్ట్రోలోన్, మెథాండియోన్, డైనోబోల్ అనేది, అలాగే మిథైల్ టెస్టోస్టెరాన్, మెబోలెరాన్ అండ్ ఆక్సాండ్రోలాన్, ఆక్సిమెథలాన్, అలాగే స్టాంజోల్ అనే ఈ యొక్క స్టెరాయిడ్స్ ఓరల్గా ఎక్కువ మంది వాడడం జరుగుతుంది. స్టెరాయిడ్స్ యూజువల్గా ఓరల్గా నోటి గుండా తీసుకోవచ్చు. కొంతమంది పెల్లెట్స్ ఏవైతే ఉన్నాయో అవి అండర్ ద స్కిన్ పెట్టుకుని మ్యూకస్ కింద కూడా పెట్టుకొని వాడుకుంటారు. కొంతమంది ఇంజెక్షన్ రూపంలో తీసుకుంటారు. అలాగే కొంతమంది దీన్ని క్రీమ్ రూపంలో కూడా స్టెరాయిడ్ ప్రొడక్ట్స్ తీసుకోవడం. ఈ స్టెరాయిడ్స్ సమ్టైమ్స్ ఫ్యాట్ని బర్న్ చేయడానికి కూడా ఉపయోగపడుతుందని ఎక్కువగా ఒబేస్ పేషెంట్స్ దీన్ని వాడడం వలన కొన్ని కాంప్లికేషన్స్ కూడా డెవలప్ అయ్యేది తెలియకుండా ఎక్కువగా వాడడం జరుగుతుంది. అనబాలిక్ స్టెరాయిడ్స్ యూజువల్గా మెడిసిన్లో వాడతాం, కానీ ఇది ఇల్లీగల్గా ఈ యొక్క స్పోర్ట్స్ మెన్ కానీ లేకపోతే జిమ్ ట్రైనర్స్ కానీ జిమ్ యూజర్స్ కానీ ఎక్కువగా దీన్ని మిస్యూజ్ అంటే 10 to 100 టైమ్స్ వాడే ఆస్కారం ఉంటుంది. ఇది బాడీలోని మజిల్ పవర్ని కానీ దాని ఎండ్యూరబిలిటీ కానీ దాని యొక్క కెపాసిటీని పెంచే విధంగా ఉపయోగపడడానికి ఇది మిస్యూజ్డ్ స్టెరాయిడ్గా వాడడం జరుగుతుంది. మనం అనబాలిక్ స్టెరాయిడ్స్ కామన్గా వాడతాం. అందులో డెకాడ్యూరోబోలిన్, టెస్టోస్టెరాన్ కాంపోనెంట్స్ అండ్ కార్టికోస్టెరాయిడ్స్ ఇలాంటివి ఎక్కువగా వాడటం వల్ల వాళ్ళ యొక్క స్ట్రెంగ్త్ని, వాళ్ళ యొక్క డ్యూరబిలిటీ ఆఫ్ వర్కౌట్ని, అంతేకాకుండా జిమ్స్లో మజిల్ మాస్ని పెంచే విధంగా, మజిల్ స్ట్రెంగ్త్ని పెంచే విధంగా ఈ యొక్క అనబాలిక్ స్టెరాయిడ్స్ ఎక్కువగా జిమ్స్లో స్పోర్ట్స్ మెన్ కానీ జిమ్స్లో కానీ వాడడం జరుగుతుంది. అనబాలిక్ స్టెరాయిడ్స్ ఎక్కువగా మనకు కామన్గా వాడేవి డ్యూరోబోలిన్, ఆనండ్రోలిన్, డెపో, టెస్టోస్టెరాన్ అండ్ అజోవిరిన్. అనబాలిక్ స్టెరాయిడ్ కామన్గా జిమ్స్లో ఎక్కువగా వాడతారు. ఎందుకంటే ఆ యొక్క మజిల్ ఇంజెక్షన్స్ కానీ ఓరల్ ట్యాబ్లెట్స్ వేసుకోవటం వల్ల వాళ్ళ యొక్క మజిల్ స్ట్రెంగ్త్ పెరగడం, వారి యొక్క స్టామినా పెరగడానికి అవకాశం ఉంటుందని వాళ్ళు ఈ యొక్క జిమ్స్లో ఎక్కువగా వాడుతూ ఉంటారు. అనబాలిక్ స్టెరాయిడ్స్ ఈ మధ్యకాలంలో మనం ఆస్టియోపోరోసిస్ ఈజ్ ద బోన్ వీక్నెస్ because of the calcium and the vitamin D deficiency from child age to the older age. The bones are very fragile. They leads to fractures in vertebral bodies or any other bones in the body. Does that the osteoporosis is the important disease in our society to treat, otherwise the morbidity will be high in the human life. Obviously osteoporosis is treatable disease. Our culture, the people not go to exposed to the sunlight leads to osteoporosis. And then if there is a calcium deficiency, the absorption of the calcium from the food or improper taking of the diet does causes the hypocalcemia. When we found this, the calcium is below 9. When we find that the vitamin D is below 30, that means there is a vitamin D deficiency and calcium does leads to osteoporosis, thus causes the weight loss, thus causes the fractures in the bones, thus causes the bony pains, hair loss and different modalities of skin disease. So when you know it is confirmed by a blood test that you have an osteoporosis disease, and then we should do a bone densitometry which is rules out whether you have an osteopenia. So osteopenia is nothing but osteoporosis. In that situation, we should appropriately diagnosis with the lab test and BMD. Once you rule out that there is a deficiency, we should supplement the person with sufficient calcium or else minimum 500 to 1000 milligrams of calcium per day with supplementation of cholecalciferol or arachidol once in a week with everyday exposure of at least half an hour in the sun. The person should be there in the sunlight early morning underneath the sun with a large area of the body is exposed without clothes. The morning sun is cool so that you will not get the skin burns, hence you should try it in the early morning. Once it has been started, then you start doing the basic exercises to strengthen your muscles around the bones so that the vascularity will be increased to the bone, rather helps you to control the osteoporosis or osteopenia. So this is the way where we should treat osteoporosis. The osteoporosis is most common after 40 age. or the children age where the people ignore the proper nutrition. In older age, especially women, we see a lot of osteoporosis. Osteoporosis disease leads to fractures in the backbones, and certain hip bones leads to fractures of the major joints. In that case, we should diagnose properly and treat the osteoporosis disease in a proper channel. The back pain and the disc prolapse back pain, these are the two different variants, are related to one area, should be ruled out. What does it cause and how does it experience? The back pain, simple back pain, we call it as a lumbago, or the spasm of the muscles due to sudden stress and strain or any injuries does cause the spasm of the muscles in the back, which lies both sides of your spinal vertebral bodies. So that is ruled out from the history and as well as the basic x-rays and the clinical examination. If there is no neurological problems and there is a localized pain and the x-ray reveals that there is a straightening of the spinal cord, is evidence that there is a possibility of lumbago or the stress and strain of the paraspinal muscles. That is called a low back pain. So the disc prolapse is the different disease where the disc in between two vertebral bodies, which acts like a shock absorber, is like a annular ring, and inside there is a jelly like shock absorber is having fluid inside, and around that there is a oil seal. When oil seal is burst out, then the oil leaks out of the shock absorber. Same way in the disc also, when then there is a injury to the annular ligament, then when it is burst open the annular ligament, there is a jelly-like fluid comes out of the annular ligament, and it protrudes out and it prolapses out, and then it puts the pressure on the spinal cord or its nerve roots. So obviously when the disc prolapse nerve root is pressed or the spinal cord is pressed, so it shows the different symptoms from the simple low back pain. The simple low back pain will have a localized pain, but the disc prolapse pain will have a radiating pain where there is a compression on the cord or a compression on the root. So exclusively when there is a compression on the right or left side of the roots, according to that, that side of the limb will be radiating pain. So obviously there will be sometimes a neurological weakness, like power in the lower limbs will be reduced whichever the nerve is affected, and there is this loss of sensory, and there is loss of reflex test, and then there is a weakness in that limb. So in that case, even sometimes there is uncontrolled bowel and bladder habits. So once the disc prolapse causes the root or cord compression, leads to certain neurological problems which are to be ruled out. So whether it's a simple low back pain or whether it's a the prolapse of the disc pain should be ruled out with a CT scan, MRI, which clearly tells you the what type of pain it is, whether it's in a disc prolapse or either it's because of the spasm of the paraspinal muscles. So this is the way we should rule out the low back pain and treat accordingly. The simple low back pain can be treated with the painkillers, bed rest, and local ointments and liniments, and then a little physiotherapy really helps you to relieve with the anti-inflammatory medicines. But when there is a disc prolapse, we must rule out the amount of disc prolapse and then the amount of neurological deficit. According to that, we should advise whether to do with the conservative treatment like back belt and painkillers, and the nerve related pain can be controlled with certain medicines that way, and the bed rest and certain times traction to the pelvis to relieve the disc problem or relieve the spasm. So the disc prolapse which is severe enough to to that the pain is continuous for more than 6 months even after the failure of all the conservative treatment, and if there is a severe neurological deficit, weakness in the limbs, then it's an indication for a surgery so that patient can be relieved of pain and the neurological problems. So this is the way we should treat pain localized or pain due to disc prolapse. What is the cause of low back pain in women? The cause of low back pain in women is foremost the spondylosis, spondylitis, spondylolisthesis, and then if there is a uterine problems, certain time there is a radiating low back pain, and if there is a renal kidney problem, that pain also leads to low back pain. So we must rule out what exactly. In women, there is a possibility of osteoporosis or bone deficiency or vitamin D deficiency or calcium deficiency leads to spondylosis in above 35 to 40 age. When there is a injury to the neck or back, there is a possibility of spondylitis, there is a possibility of infections in the joint, there is a possibility of immunological disorder like rheumatoid arthritis, and then any other specific or non-specific arthritis leads to joint pains that does cause the spondylitis. The obese woman where there is an injury to the low back, in that condition the vertebral bodies will be displaced from one joint to another joint in L4, L5 or L5, S1 levels. Such the displacement of the vertebra over the vertebra in forward space called as a listhesis or spondylolisthesis, and then there is a porosis, and then there is a listhesis, and there is a spondylosis. Apart from that, when there is a abdominal infections like pelvic infections, uterine infections does cause the radiating pain to the back. Even the post delivery, there is a pelvis variability causes the pain in the back. And then there is a stones in the kidney, and there is a infections in the kidney, there is a bleeding in the kidney, does cause the radiating pain to the back. These are the various pains we see it in women where we should be handle it. In back pain, most of the people in obese people, due to rupture to the disc, disc is between the two vertebral body which act like a shock absorber. When this shock absorber or a disc is burst open, then the disc material inside is like a jelly material will protrude out back onto the spinal cord, causes the pressure on the spinal cord, leads to the low back pain. And then there is a wedge compression fractures in the vertebral body also causes the pain in the woman. And then there is a possibility of tumors in the spinal cord, possibility of tumors in the bones, possibility of Cox infection like tuberculosis infection in the low back pain does leads to the pain. So these are the various causes for the pain which we need to rule out with X-ray, MRI, CT scans, and if necessary certain blood tests to rule out what type of pain in the low back area. Once you come to a conclusion that the diagnosis is appropriate, then you should treat the patient accordingly so that the pain could be controlled. So the 5 problems in the woman is the most important. These causes to be ruled out with a proper clinical diagnosis as well as the diagnostic documents, so that the appropriate treatment can be implemented from our side to treat the patient. Abdominal pain during the menstrual period. Is it dangerous? Does it cause anything in the future? We call it as a dysmenorrhea. The dysmenorrhea, pain in the abdomen, is due to the spasm of the muscles in the uterus, leads to pain. When there is a shedding of the endometrium of the uterus does during the bleeding cause the pain in the muscles of the uterus, leads to pain in the abdomen. It's a natural to every female during their lifetime after the maturity. So whenever there is a bleeding during the menstrual period, obviously they feel sick, they feel feverish, and then there is a cramps in the abdomen. These are the natural process in the female body during the period, that is for at least 2 to 5 days. Obviously nothing to worry about it, and does not cause much more problems in future. When there is a severe intolerable pain during the menstrual period, you should take the antispasmodics, that muscle relaxants does really helps you to control the muscular pain or muscle cramps due to the periods. Otherwise there is nothing to worry about the cramps, abdominal cramps during the periods, the menstrual periods, and the simply within 2 to 3 days that pain, abdominal pain winds down. So you must rule out certain young females or youth females having uterine infections associated with menstrual periods does really continues the lower abdomen pain for more days. So obviously there is a white discharge, then should ruled out with a gynecologist whether is there any discharge, white discharge is infective, and what type of infection, it's in fungal infections or bacterial infections should rule out, and then the fungal infections and bacterial infections should be treated. Otherwise a simple short time menstrual period from 2 to 5 days, during that there is a mild to moderate pain, abdominal pain is not much worried, because that's a natural process takes place during the menstrual period in the uterine muscles. So obviously we must take care. We should have a proper nutrition to the child or the youth. We should have a good hemoglobin content. The hemoglobin should be above 11 to 12 for the females, and then they should have a proper nutrition, so that certain times the anemia also causes a severe pain and does have a multiple problems, generalized weakness, pains, and all that. So abdominal pain is not that variable problem during the periods, does not cause much or any problems in future for a menstrual abdominal pain. Those are the natural pains which physiologically happens in your body, and then you should take care of your anemia, you should take care of your nutrition, and if anything more than 4 to 5 days, there is a bleeding is more than 4 to 5 days, there is a pain more than 5 days, then you should contact your gynecologist to rule out any pathological problem in your uterine body. What is the cartilage? Where does it exist? What is the importance of cartilage? Cartilage is the soft bone lies in between the two bones in the joint. Cartilage is the major source of movement of the joint. It really helps to make your joint movement smoother, and it helps you to do much more activities during your life. Cartilage is the cells, it has a cartilaginous cells which are soft tissue cells which helps you to maintain the joint structure and then its functional ability. So what exactly happens? As it is, we know it acts like a shock absorber to the joint. When you act upon your joint, when you jump, walk, or does lot of sports activities, there will be compression between two bones in the joint. In that situation, this cartilage will act like a shock absorber to help you to go in smoother way, and then it will not allow to damage the both bone ends. So obviously this cartilage is the most important structure in the joint where we need to take care of it. So a lot of people get injured this cartilage due to various sports activities or road traffic accidents or any other things. So when you want to diagnose this cartilage, the best source of diagnosing the cartilage is to do a MRI. That is the best way. In MRI we can rule out the cartilage injury. So when MRI can rule out even 1.1 mm of cartilage damage, and it gives us the complete picture of cartilage, how badly are injured, how smaller the injury to the cartilage. So the cartilage nutrition is the most important, which is supplied from the synovial membrane, and then the vasculature around the joint. The cartilage, like anywhere, even in the any joint, it will surface as the bone ends. When bone ends are covered with the cartilage, during the friction in between the two joints, the cartilage will give you a smoother ability to walk, and it will help you to avoid any pain. So the cartilage is the most important part of the joint, where the joint life will be depends on it. So obviously when there is a cartilage injury, there is a patchy cartilage injury, there are the modes of treatment we can treat the patient. So for example, stage 1 cartilage damage, it's an early stage where advising few medicines and then regenerative medicines which helps you to regenerate the cartilage. When the cartilage is in a patchy mannered damage, then we can inject the hyaluronate injections which regenerate the cartilage. Otherwise, we can inject the PRPs into the patchy damage to the cartilage, where we can regenerate the cartilage. If not, then ultimately if total cartilage is eroded, and then if there is a damage to the hard bone, there is a deformity, then we must do a total knee replacement in stage 4 damage to the joint. So in this section, the cartilage is the most important part of the joint, which is the most active and very important part of the joint, where we should take care of in a proper channel, so that the person does not suffer from a joint pain or any other problems. The young age, the youth, the people joints get wear and tear recently because of certain modalities. Mostly the trauma, trivial injuries which are unknown by a patient. Most of the knee joints wear and tear in younger people could be because of the early injury to the joint, and there is a trivial injury, and then there is a micro trauma to the bones ends does leads to the wear and tear of the joint. And second thing is, there is a infective changes in the childhood, where it damage to the soft tissue as well as the bone ends of the femur and tibia, where leads to wear and tear in the knee joint. And then there is a possibility of occupational hazards in youth leads to joint wear and tear and pains. And even certain cases of juvenile rheumatoid arthritis also, or juvenile arthritis also, where the wear and tear because of the erosions of the ends of the joint leads to the wear and tear. So these are the multiple causes where the wear and tear in the youth you could see, and you should rule out whether what type of wear and tear and what type of degenerative changes is occurred in younger or youth group. So obviously when we know that the cause, we should take a pictures, X-rays, and then MRI, CT scan if necessary, and then certain basic blood tests to rule out immunological disorder or in a septic disorder or an existing predisposing disease or anything. So once you rule out the exact cause of the wear and tear, and then we can treat accordingly. So most of the time, young people, when there is a trivial injury, trivial in the sense childhood injuries like fall from the height, and then there is a certain times what happens, when sports activities, there will be injury to the soft tissue in the joint. That soft tissue wear and tear also leads to more friction in the hard bones of the femur and tibia, leads to degenerative arthritis. So such degenerative or such wear and tear arthritis must be treated promptly, otherwise the future, as early as the age of 40, 50, the youth gets their degenerative joint into severe deformity and pain, thus might require to do a major surgery. So in youth, obviously, whenever there is a small trivial injuries, whenever there is a ligament or crucial ligaments or meniscal injuries, it should be treated immediately, so that the wear and tear does not increase or does provocate for the future wear and tear damage. So obviously, when we see this, there is a other word we call it for the wear and tear is a degenerative, or as a continuation collision of the bone ends causes the pain, deformity, swelling, and then there is severe inflammatory reaction. So such cases we must follow it properly. We must rule out that what type of trivial injury or major injury happened during their childhood or adolescent age. Obviously, when we know the exact cause for the wear and tear, that means if there is a soft tissue injury, should treated accordingly. If there is a subchondral bone injury, sometimes what exactly happens is there is a intra-articular fractures. That means the bone ends get fractured. There is a splinter in the articular cartilage of the bone. Such bones, if are not properly fixed, are not treated properly, then it might lead to something like a bearing, where if the chirras are damaged, the bearing gets more damage. In that sense, then when there is articular joint is damaged, then particularly the joint end bones get eroded, and then leads to high range of wear and tear, thus causes the more degenerative damage to the bone. So you must take care in that sense. And then if it is a simple, then conservative treatment of medicines, physiotherapy does really helps to recover. If there is a major intra-articular damage or something different, then according to the age and then according to the amount of damage to the joint, will be calculated to do a major surgery like TKR necessary or not. So in this way, we should well plan the youth that if they have a wear and tear, then it should be calculated, and we should take care of the joint very well. Thank you. Dr. Vijay Chairman, Ethics Committee, Clinical Research and Trials, Hyderabad. Today we'll discuss about the persons after or during the COVID or after the COVID suffering from joint pains, that is arthritis. Obviously, most of the virus does affect the synovial membrane of the joint. The synovial membrane and the synovial fluid is the a constitution of a joint, where the lubricating fluid formed by the membrane of the joint. So that membrane is called synovial membrane. So obviously the lubricating fluid is called synovial fluid. So when the most of the viruses does affect the fluid of joint, that is a synovial fluid, leads to joint pains. So these joint pains usually wean down as the virus goes out of your body, or it is acted upon the immunological system or antibodies of your body. Once the antibodies are acted on the virus of the generalized system, then obviously the the virus effect on the synovial fluid will come down. So obviously, initially when there is a, viral effect, then leads to a infection or localized inflammation. That means pain and swelling in the joint, and then the restricted movement of the joint. This does will sustain for a little longer period, and sometimes many months and days. So obviously people scared of it. Why is being affected the joint pains, even though the virus is gone out of their body. So usually what exactly happens, the pathology when there is a infection, the viral infection, initially the virus effect on your body will be around 10 to 14 days. After the 14 days, the virus automatically killed by the antibodies in your body. But obviously the side effects of the virus, does it means that when there will be a chronic disease process in the joint synovial fluid and synovial membrane, where it takes longer time to recover from those complications or side effects developed by the virus. So any joint pains, especially knee joint pains, when there is a large area of synovial membrane with large, much more quantity of the fluid, that fluid does affect the joint variability, wear and tear, and then obviously in older age group, obviously there is a degenerative changes, and there is a some side effects and complications in the joints leads to the pain which sustain for the longer time. So anyway, as such, there is nothing precautions you can take for the virus, because virus, when, how, where it enters into your body, you do not know. So even if a few number of persons only get the joint effect due to the virus, not all the people who are infected with virus will not get the complications like joint pains. So this joint pain should rule out with an infective joint pains, and then immunological disorder joint pain like rheumatoid arthritis, gouty arthritis, or psoriatic arthritis, or even in old age group degenerative osteoarthritis. So apart from this, even the traumatic arthritis also will see in most of the cases, in which we have to rule out with all the tests and then come to conclusion that could be cause is virus effect. So the COVID virus enormously, it is into the worldwide pandemic spreading, and that time there are many people are suffering with fever, sore throat, pain, and with these joint pains. So obviously such problems will persist for longer time. The choice of investigation is RT-PCR to rule out the virus is existing or not, or what type of virus it is, and then treat accordingly the virus treatment. Apart from that, the basic line of treatment is the painkiller, something like a paracetamol or diclofenac sodium, with regular physiotherapy does really helps them to rule out. So basic x-rays, and then basic blood picture, and then you do the basic investigations, and then once you confirm that it's in a viral effect, then treat symptomatically so that the patient will recover. ఎన్ని నిమిషాలు సార్ సార్ రండి
5 minutes.
ఎన్ని నిమిషాలు
5 నిమిషాలు వచ్చింది సార్.
2 minutes కి ఇట్లా చెప్పు, 3 minutes, 4 minutes, 5 ఇట్లా చెప్పు నాకు.
2 minutes అయినా సిగ్నల్ ఇవ్వాలా సార్?
2, 3, 4, 5 2-4 minutes కు నువ్వు 2 సార్లు చెప్పు చాలు. డాక్టర్ మీ